I suppose one of the things is that we know that on the undergraduate programme for pre-registration it's very variable about the cancer education people
absolutely.
get. And one of the things is that it's very important to understand the core anatomy and physiology of cancer, why cancer occurs, why it spreads, and why different cancers have different pathways in terms of their physiology. So although it's important to know about the new treatments, without an underlying knowledge base in anatomy and physiology, sometimes that understanding is quite difficult as well, because the new treatments are incredibly complex. But I think it's also about education that covers the spectrum and not just focuses on the exciting new treatments, but actually on the effects of those treatments on that individual. So I think it's some of the understanding around why a side effect occurs is based on an understanding of the cell cycle and why the physiology of the disease, and therefore why some people suffer from side effects more than others and how that relates to the treatment. And I suppose the other thing is that we have a lot of different treatments that we're using, and most of those treatments still given in specialist centres. So radiotherapy, chemotherapy are still given in specialist areas. And so for many nurses who are general nurses getting their first post in a general area, they may not actually be exposed to them. So it gives, but the patients will be in their clinical areas and they'll be asking them questions about it. So I think one of the good things about the framework is that it goes down to basics, really. It takes it right down to basics about what is required at a basic level to understand cancer, and then how you build on that as you become more involved. So our view is that everybody who meets somebody affected with cancer should have a basic understanding of what the difference between the treatments are, why some people might get side effects and not, what the disease physiology is, and therefore then they can build on that to gain more skills.
It provides them with the, as you say, the building blocks, the underpinning principles, so that, you know, as new treatments, new personalised medicine comes along, people will just be able to understand how that works, because they already understand the underpinning physiological mechanisms of the process of carcinogenesis and the way in which treatments work. In addition to that as well, the framework brings in the other aspects of care for people affected by cancer, and of course we want to build on the skills of communication, psychological and physical support, so that students, you know, will already be learning these, but then they can apply these to people affected by cancer, and start to think about some of the issues about what might be the impact of a diagnosis, as well as the impact of treatments, so that they can use those skills within this specialist field as well. And as Sue says, it provides the building blocks for the future, those who want to move into specialist cancer care, but also for those who have other roles where they do have some contact with people affected by cancer and can use them and understand what's happening with the patient and how to plan their care.
And I think that's really critical for the younger nurses coming out of registration into the first staffing post, because sometimes, because cancer has become a specialism in its own right, they forget that actually working in an endocrinology unit with diabetes is an extremely useful learning experience. So is working in a cardiac unit, respiratory, because people who are affected by cancer now have other comorbidities. And so it's not just about focusing on the cancer, we're going to have to focus on other areas. And so for somebody thinking that they want to come into cancer nursing, in fact, they're probably already in it, because half the patients in their clinical area. But I think because we tend to put it under a specialism, sometimes people forget that actually, no, you're caring for people affected by cancer every day of your working life, but actually you see yourself as a respiratory nurse, or you see yourself as a diabetic specialist, but actually you've got a patient who's got diabetes and got cancer. So I think that's why it's so important that people sort of look at things more broadly. And one of the good things about the framework is because it's quite detailed, it starts giving an individual nurse an opportunity to think, well, actually, where are the aspects in my practice where I need to improve? Maybe I've got very good communication skills, but actually I haven't got enough knowledge about the different treatments, and that's where I need to find my education. So I think it gives people an opportunity to look across the whole spectrum of care that we would give to a person and their family. And one of the other things is it's not just about the adult. It's applicable to children, nurses, and people who work in any field of practice that might come across somebody affected by cancer. So I think that's really critical, because the clinical areas that are not specialised in cancer, which is most of the district general hospitals across the UK, don't have specialist oncology units. They have a lot of nurse specialists, but if we involve the non-specialists and give them an opportunity to upskill, I think that would really help the service overall. So I think for the nurse coming in, it's going to give them a little bit more direction. And I know in the university frequently students say, I want to work in oncology and palliative care, what can I do? And we're going to be able to say, well, actually now there's an education and career framework, have a look at it and see what you may have to do to ensure that you're going to meet the requirements moving forward. So I think it's going to give the nurses that are really interested in oncology, and there is a lot of people really interested.